Hey guys, it's 6:53 a.m. It's still dark in here as you can see. I feel a whole lot better than I felt yesterday. So I am back in a positive mind. One of the girls that went yesterday reached out to me through WhatsApp, and she showed me what she can see so far. She's still laying in a bed and has a catheter. But just seeing her results and feeling how she felt and everything like that made me feel so much better. This was actually the same girl that I initially ran into when my hemo was low and her hemo was low. So she was supposed to have surgery Monday. I was supposed to have it Tuesday. So she ended up having it yesterday, and here I am first thing today. So, yeah, I'm feeling like things are going to be well and it's going to be so worth it. She kept assuring me it's worth it, it's worth it. And it's best that you get her at the top of the day. And so, she had her yesterday. She was first. So I'll be first today. I'm looking forward to it. I'm excited. And, yeah, we'll see how everything goes. Hopefully I have great results. I slept with my energy stones that my friend gave me last night. I literally, because I slept on my back, I slept with them on my chest. And they gave me such a peaceful sleep. I will say that I'm not sleeping like my normal 5 to 6 hours through here. I'm sleeping maybe 3 hours at the most, and then I'm waking up. I don't know. It's been like that the entire time I've been here. I haven't been able to just sleep like I would normally be able to sleep. So that's just another process. But yeah, I just wanted to give you guys a quick little video this morning just in case I'm not able to do it at any other point. Again, it's 6:54 right now, and they're supposed to be coming and getting me. She said 9 o'clock. I'm thinking it's probably going to be more like 11. So I'm thinking within the next couple of hours, somebody should be coming to get me, and my boss should get to moving. I'll keep you guys updated the best that I can, and I appreciate each and every one of you guys for tuning in. Okay, dolls, so Duran just came and see me in her gym attire and told me that she's here and she's about to get ready for me. She said she's about to tell them to go ahead and get me back and start getting me prepped. So this will be the last clip before I make it to the flat side. I know this has been a long journey. I appreciate every one of you for hanging in with me throughout this journey. And this is about to be it. So I'm happy. There they go. Okay, y'all, I made it to the flat side. I can't really keep my eyes open. And I can't really show y'all anything because they got me wrapped up in this tape. Yeah. I'm about to probably pass back out, but I wanted to just come on here while I'm still looping so you can kind of see. They actually came and got me on the last clip, so they rolled me back, got me today. The next day I know it was surgery. It went so quick. All right, take care. Okay, hey dolls, so I got a little more sleep. It's 7 o'clock right now. So they gave me some more pain medicine in my IV. I'm sure that's going to be kicking my butt in a minute, probably putting me back to sleep. I was just able to try to drink some water. Now, remember, you guys, I am a gastric sleeve patient. So this surgery apparently compresses you on the inside. And I don't think it probably helps that I got the gastric sleeve. So I just drank a little bitty cup of water, and I threw that water right back up. I don't know if maybe I was just too excited and I drank the water too quick, but it came right back up, and it was literally the same amount of water that I drank. I was able to throw it back up in a little styrofoam cup, the same amount of water. So I'm sucking on the peppermint right now because the peppermint helps with the nausea. So hopefully I don't throw up again. I'm going to just probably try to just drink enough water to keep my mouth wet. And I'm just chill until tomorrow. I just feel really tight. I'm not really in any pain. It's just tight. So my breaths are a little shorter than they normally are. I feel like I can't talk as quick as I normally talk because I'm having to breathe more frequently. But again, not terrible pain.
The only thing irritating about this is that I keep bleeding all over the place. Like, let me see. I'm gonna try to lift up so you can kind of see. Like, I'm bleeding, like all up underneath me and stuff. I don't know if y'all can see it, but anyway, I'm bleeding underneath me, and they're not gonna clean it up because I'm gonna keep bleeding. So it makes no sense for them to keep cleaning it up. I get it. But anyway, this is just a quick video. Like I told y'all, I wanted to go through the whole process with y'all so y'all can see not only the good, but you'll see the bad as well. So yeah, I think that's all I got, because literally I just been asleep. So don't expect to do too much afterwards but sleep.
Hey, so dolls, Dr. Duran came and saw me before she left. It was about 9 o'clock. And I hadn't even seen my stomach yet because it's all bandaged up. But she had pictures, and she showed me the pictures. And I took a snap, like a picture of the picture, so I could see them. Like, I'm in love with my stomach so far. I haven't even seen my butt. They do have me sitting on my butt. She told me I can get up tomorrow. I have a catheter in, still an IV, giving me fluids. I tried to initially drink water when they told me I could drink, which was about a 7. I did puke it up, right back up. But I went back and I tried it again, and I just drank very slow, and I didn't throw it up. So I guess the thing is, I just have to really like pace myself when it comes to drinking. I also was able to hold down some Jello, so I tried that. I still have not tried any solid food. That won't be until tomorrow. She did tell me special instructions to make sure that when I leave here that I drink plenty of water. She said that's going to help with the swelling. I have to drink a whole bunch of water if I want my swelling to go down, and compression. So the pictures that she's already showed me of me should go down a little bit more because I'm swollen. Yeah, I'm like super ecstatic with my pictures. I will show you guys at the end of the actual video that I'm putting together now. It'll be at the end so you guys can see all the stress and all the irritation that I went through to get here. I'm happy because I feel like no other doctor would have delivered the tummy tuck that she delivered on me. Like I said, I haven't even looked at the butt. And remember, from the beginning, I told y'all my biggest concern area was my stomach. That was the thing that I hated about me the most, to where even if I didn't get a butt, I would have been fine. So that's why I'm so happy here. The butt is just like a bonus to me. The tummy is, in my opinion, she did an amazing job with what I gave her. So yeah, like I said, I don't feel like I would have got these results from anybody else. And all the little twists and turns that I had to take to get here, I feel were worth it with seeing those results. She does really care for you. That's another thing that she has shown me throughout this process. When she told me she was postponing, she came and talked to me. I was the first person she walked into when she first got here. She still had her keys in her hand, her gym clothes, and everything. She came in here and talked to me, and she said, okay, I'm about to go upstairs and see my girls from yesterday, and then I'm going to have them go ahead and get you prepped so I can be ready for you. And I'll be damn. As soon as she walked out of here, within 15 minutes, somebody was in here for me, getting me upstairs, getting me prepped, and we was ready to go. Actually, after they gave me the epidural, because they didn't give me a little blue pill. So the whole little blue pill thing, I didn't experience the blue pill, guys. They gave me an epidural. After they gave me the epidural, I don't remember nothing else. Like, it's crazy because I swear after the epidural, I was done. I never took a blue pill. Never took a blue pill. So yeah, and I'll give you guys more information in regards to my surgery later, because I did wake up in my surgery, but I did not feel any pain or discomfort or anything. And she talked to me while I was up during the surgery. When they was putting my stomach back together, I was up. So anyway, I'll go into more details on that later. I'm about to go to bed for the night. They've been coming in here, still giving me pain medicine through my IV. They've also been changing the fluids, continuing to give me fluid. I got a shot in the leg, which I'm assuming is the Lovenox, to make sure I don't get blood clots. And then Dr. Duran, when she came in here, I kind of had my leg propped up. She was like, no, you lay flat. And so I lay flat. And then I
I also got a drain that has been, draining blood. At this point, I haven't had to get no blood transfusion, but I'll let you guys know if any of that changes. And yeah, I'm good. So this is it for tonight. I probably won't load this video tonight. I'm going to keep adding on to it until I get out of the hospital. So talk to you guys soon. I did make sure I updated, IG and Facebook to let everybody know that I was okay. Hey dolls, so it is 8:28 a.m. I've actually been up like pretty much most of the night. I slept right after surgery in a while, and I've kind of been up. I haven't really been able to get super comfortable and go to sleep, mainly because I don't like the feeling of this blood on me. And that's not something that they're willing to clean up and take off. I'm waiting on Duran's assistants to come this morning. They're supposed to clean me up and put me in my faja. Once they clean me up and put me in my faja, I think from that point I'll be able to go back to the recovery house shortly after. They did come in at 4:30 a.m. They drew my blood, and I'm assuming, that's maybe what they're going to make sure that I still have enough blood in my body and whatnot. They drew my blood at 4:30. Then they came back, switched my IV. So I've had like four. They're like, that was right there. I've had like four of those since I've been here. So they keep you pumped with fluid. Again, I have a catheter in. So I'm not able to get up and use the restroom. And that is driving me crazy because I'm a busybody and I can't move and go anywhere. Gotta lay in this bed. Also, I've got this, the drain for the blood. I'll show you that later because I can't flip the camera with me on it right now, but I'll show you that before we get off. So that is constantly draining the blood off of me, and the drain actually connects. They like put a hole at the top part of your vagina, and it's coming out of there and it's going into this drain. And I've seen them empty it like 3 times, so it's been filling up. So I don't know how much blood I've actually lost. I don't feel bad. I feel good. Yesterday, I was like really, really loopy, and I couldn't stare at my phone for too long because it was making me dizzy. So everybody that I was talking to yesterday evening, I was like, look, don't text me, just call. Because if I stare at the phone, it was making me like dizzy and nauseous. So I learned how to just curve through that. This morning, I'm perfectly fine. I can look at the phone. I can text. I can do, everything. I honestly think I can get up, but she told me not to get up. So I'm going to do as she said and lay here until they come. My butt is sore. I have not saw my butt yet. I have saw a picture of my stomach, which I will attach that picture at the end of the video. So if you watch all the way through, you will see my stomach. But so, and then the picture of my stomach that I actually got that from Dr. Duran. She came to see me last night before she left, and that's where I saw the pictures because, she takes her pictures, and she took the pictures of my stomach, and I'm, like, honestly so in love and so impressed. Like, I didn't even think my stomach was going to get that small. And that's still, pre-op, so it's, it's still a process they got to go through with swelling and all of that. Before it gets to its full results. So what I saw so far, I'm very pleased. She even took a picture of all the fat and the skin that she removed from my stomach. And I wanted her to weigh it, but that completely slipped my mind. So I didn't get a chance to ask her to weigh it. But I figured I'll just try to weigh myself and see what the difference is, and that can kind of give me an estimate on what was taken out. Again, my butt I have not saw. Because I can't get up, and I've been sitting on it. Duran said it looks nice, so I'm trusting what she says, and I'll see it when I get up. I believe they put a little bit in my hips too because they're hard, as well as my butt. So you can tell where they put it in at because it's like really, really hard right now. I'll be able to kind of examine my body a little bit more when I can get out of this bed. Right now, I can't do nothing. So that's why I'm coming on and giving y'all these little updates now. So that way you kind of are going through the process with me and how I'm discovering my own damn body. I just told my one friend it's a unsolved mystery on what my butt looks like, which is the dang on truth. So we'll get there. But overall, I'm happy. It was worth the couple days of delay.
Especially once you see my stomach, you'll be like, yeah, it was worth it, sis. And if you think about it, every delay that was given to me was for the protection of my health. The first, my hemoglobin wasn't right. The second, she was tired. She had worked 3 bodies, and who wants to be the fourth? So everything, like I said, was with the best intentions for me. And now that it's all over and done with, I'm out of my emotions and everything. I'm happy things turned out the way that they turned out. I don't have to extend my stay in the DR because I initially planned to be here for the full 14 days after surgery. So now that it's taking me 3 days beyond that, I'll be here 11 days after surgery, which the minimum is 10. So it'll work out. Like I said, I'll be here 11 days after surgery, and then I'll get up out of here. So, yeah, I think that's pretty much it for now. I'm going to show you guys this drain so you can see what that looks like. And I don't think there's anything else at this point. Yeah, questions, y'all. Y'all can keep putting the questions. Once I get back to the recovery house and get comfortable and stuff like that, then I'll start answering them. So you can pile them up for me and I'll get to them. It's just, I'm not going to get to them while I'm in this hospital. I'm completely uncomfortable. Like I said, I've been sitting on blood all night and it's sticky. Like, it feels weird. I don't know if I'm sweating or if it's blood. Like, it's like a combination of them both. And it just feels so nasty. So I really cannot wait until they come clean me up. I don't move like this and I don't like it. So anyway, all right, I'm gonna show you this drain and then I'll talk to you guys later. Okay, so this is the drain and it fills up. Like, it's low right now because I just emptied it, but it will fill up. And then there goes the hose and it goes here. I'm not gonna show you my vagina, but there goes the drains. As you can see, I've been bleeding. Like I said, it's yucky. There's blood everywhere. And I'm just waiting to be cleaned up. So, and my back feels very fluffy right now. Like, from the lipo, and it feels very fluffy. My midsection is all wrapped up. Let me see if I can show y'all. So my midsection is all wrapped up like that. But again, my back is like fluffy. So because it hasn't been compressed and they got to put that faja on. But that's that. And there's the drain. Okay. Okay, y'all. So I just got my little pain pump and they put my faja on. We haven't snapped it all the way yet because I'm still waiting on Castro to come and take my catheter out that's holding my urine. And then I also they just told me my hemo was at a 9 point something. I can't remember exactly, but it's high enough to where I don't need a blood transfusion. I'll just go back to continuing taking my supplements, and that should get my iron back up, my blood levels back up. So far so good. I'm not in any like pain. It's just uncomfortable. Especially once they got me out of the bed, I was perfectly fine in the bed. And once they got me out the bed and I had to move around, I'm not gonna lie, when they put the faja on, I got lightheaded. Because that was the first time I've been up since, surgery. So I got lightheaded. I didn't pass out, but I was lightheaded. So, what was I about to say? So they got that on, and now I'm just sitting in the chair. I had my overnight nurse get my boppy pillow. I actually bought another boppy pillow when I was over here because the lady that makes them over here, they're way bigger than the boppy pillows we can get in the States. So I bought another one, and I'm sitting on that right now because my butt hurts sitting in a chair. So I'm sitting on the boppy pillow waiting for Castro. Hopefully this doesn't take long. I still have not eaten. They brought me some soup in here this morning and I don't know, I wasn't feeling no soup. So all I've been doing is chewing gum, drinking water, and drinking these juices. I'm drinking peach juice right now. So this is where I'm at so far. It's about 10:28 a.m. And yeah, this is where we're at. And I'll keep filming to update you guys later. Hey guys, so I am at the Oxy Life
Fast Recovery Genuine Care. It's a HBOT. It's called Hyperbariatric Oxygen Therapy. The reason why I'm here is Dr. Castro came in and looked at my scar today and saw that it had like some dark mark on it. And typically, she said that that means that the area is like dying off and it needs oxygen. So this place is an oxygen chamber that is going to help my scar heal. It's $75 for one session, and I'm waiting right now to receive it. I am going to take pictures of the pamphlet just in case any of you dolls have more questions about what this procedure actually does. I've just read through it and I got a better understanding of it. So yeah, I mean, I'm willing to do whatever it takes to heal my body and make me feel better as soon as possible. I'm not feeling too bad, just uncomfortable, but I am bleeding a lot. Like, I'm leaking everywhere I go. And Castro does not want me to close my faja. So, like, I got it on my legs and stuff, but she doesn't want me to close it over my stomach until Monday when I go back to see her. And she wants me to do this oxygen treatment. So, we'll do that. She told me also to go home and go to the recovery house and put my Manuka honey. And Manuka honey, Neosporin, and some other prescription she prescribed that I haven't went to go get yet. So I'll let you guys know about that when I go get it. As you can see, I look a hot ass mess. I don't plan on probably looking no better than this for a while. It's going to be a process. But I just wanted to fill you guys in on what I'm doing. And yeah, I ordered the pain pump. But when I left the actual clinic, they took my pain pump out of my IV because they took the solution out of the IV, so they took them both out. So now I'm already have to ask my recovery house to put my pain pump back in. So yeah, and the pain pump is this. This is hanging. This is the pain pump. So it doesn't go on my hand, but it plugs into the IV on my hand, but it's hanging around my neck. So I just have to get that put back in. So I'm running around with that around my neck. The drain hanging down my leg compression. So I got to keep leg compressions on as well as faja, but I cannot button the faja. So here we are. This is, of course, the irritating, the ugly truth that people don't tell you, the part that's painful, the part that's not fun. I'm walking around here like the Hunchback of Notre Dame because I cannot stand up. They said do not stand up, even though I'm doing pretty good with my pain. And I could, my doctor told me to stop doing that because I'm putting strain on the incision. So I'm like literally having to walk hunched over. And even when I'm sitting, I can't sit straight up. I have to hunch over just to keep that resistance and that pull off of the incision. So I'll give you guys some more later and we'll go from there. Okay, so guys, it's been 2 days since I posted. I'm just wrapping up this video because I wanted to just make it a summary of 2 days, Friday and Saturday. So just to give you guys an update, my Saturday was very, very busy. Was at the hospital, had to go to the oxygen chamber. And after going to the oxygen chamber, I had to go fill these extra prescriptions that Dr. Castro wrote me. And then after that, got to the recovery house. They had no power. So imagine how frustrated and irritated I was at that point. I contacted the owner. I was like, hey, this is not what I signed up for. I've had a rough day. This is not going to work. And I don't know if it was God, but the lights cut right on. Right when I said that. Like, she said that there was an outage in the entire area. But literally, when I sent her that message, I want to say within 5 minutes, the lights came on. God must have knew I had had enough. So, that happened. Then they cleaned me up because I hadn't cleaned up properly in days. So, they gave me like basically a little whole bath with my little camping wipes that you have to bring with you or whatever, and some Hibiclens. Hibiclens is the surgical soap. I've read about cleaning up in that because it should help you get infections or whatever, cleaning up with that soap. So I had them clean me up. They took me out of my faja to wash it because, remember, I was leaking all day. Like, I had a big blotch of blood
on my back. Everywhere I went, it was a big blockage of blood. And everywhere I sat down, people was putting chuck pads down so I wouldn't leak on their seat. So took my faja off, washed it. So I was out of the faja for a little bit while it was being washed. Then, like when I was out of my faja, I felt funny. And then as soon as she put me in my faja, I instantly felt better. She rubbed some manuka honey and also some Neosporin on some of my bruises and my scars. So like I haven't, I'm gonna ask them to take a picture of it so that way y'all can see. But my back is bruised, like purple and black in spots, and then like my scar, which is why I went to the oxygen chamber, has like this purple dark line in the middle of it going up to my navel. And that's what they're concerned about. So I talked to the owner of my recovery house. Dr. Castro told me not to button my file. Well, my recovery house said that she thinks it would be a good idea to do it. So we went ahead and buttoned up the file. I will say it was a struggle doing that. But once it got done, I felt better. Like I felt more confined. I didn't feel all over the place. Like I think it's helping with my swelling. I've attached a picture of what it looks like at the end of this video, as well as my before and my after. So, and of course, remember, y'all, my body is going to change. So as you guys continue to go on this journey with me, you'll be able to see how my body changes. And I have not still seen my butt. So that's still a mystery to us all. I've been walking past mirrors and none of the mirrors is long enough for me to check out my butt. So it just must not be meant for me to look at my butt. But I will say, I'm propped up on this boppy pillow that I bought from down here. And that boppy pillow is the truth. Like my ass was hurting all day yesterday. But I'm in this recliner. And the way I got this boppy pillow and these pillows underneath my legs, I was able to fall asleep really good. And it's been great. So that's the update on that. And let me finish. What was I saying about yesterday? Okay, so after they cleaned me up, I took all my medicines, started on all my prescription antibiotics, pain pills. She does have you start back on a B12, not a multivitamin. I had a different prescription list, which I'll share with you guys if you need it. Apparently, they kind of customize each person's prescriptions. Some of the prescriptions are just systematic, which is the same prescriptions that I received from my friend. But when you go see her, some things they'll add in that are customized to you and what you're going to need. So I gotta obviously build my iron back up. I didn't get a blood transfusion, but my hemo is like a 9 point something. So I think that is why every time I get up, I get lightheaded. So like when I get up and I do something for a period of time, it makes me lightheaded. So I'm just gonna take it easy the next couple of days and stay away from doing anything that's keeping me on my feet for long periods of time. Like I get up, I go to the bathroom, I get up, go eat, that type of thing. But like, and then when I gotta put my faja on, for some reason that makes me lightheaded every time because it's tight. And then you got two people tugging, trying to help you pull it up. It's just it's work. I'm trying to think after that. I mean, to be completely honest with you guys, after I took the medicines, I fell asleep. I was comfortable. I sat on all these pillows. You see, I got my airplane pillow around my neck, my boppy pillow under my butt, and a big long pillow up under my back. Then I got another big long pillow up under my knees. And I'm in a recliner. So like I'm pushed up because if I don't sit on this pillow for my butt, my ass is hurting because it's hard as a rock. See, nobody really tells you that your ass gets hard before it gets soft. So it feels like sitting on a concrete surface at all times with your ass because it's hard. Because of the fat they injected. It just gets hard. So that's something that, of course, nobody's probably told you. I'm telling you, it's uncomfortable. But I'm going to go ahead and stop holding on to this footage. That's why I wanted to make this last clip today. And then, of course, I'll start, vlogging today, which is Sunday. But I wanted to get this video out and just let you guys know this is my journey from Friday and Saturday, and that I do apologize for keeping you guys waiting. I did post on IG and Facebook just to let you guys know that I was okay and I made it to the flat side. I didn't really have the energy in me to keep up and try to respond to each and every one of y'all. Like I even had to tell some of my family last night that I didn't feel like talking. Like this is a process. It's not easy. It's very tiring. And I mean, we glamorify it, but I want people to know that yes, it's glamorified, but it comes at a price. So you're gonna get the glamour at the end, but going through the process is not as easy as it looks. And so I just kind of was ready to shut the world off yesterday because I was so irritated, tired. I was tired of every time I got up getting lightheaded, and I'm really a self-sufficient person, so that bothers me when I'm not able to do things for myself. Like I hate asking for favors and I hate asking for things, and so I think that's the thing that is getting in between me and this recovery house is because I'm so used to doing stuff by myself. I don't want to ask, so then I just go without, and I know I gotta stop right now. So I'm gonna get used to it. But anyway, here goes your video, and you guys will hear from me again probably in the next day or so. Thank you guys all for watching and tuning in, and I hope you're enjoying all the content that I'm giving.
Every single day